Hi, I'm Dr. Priyanka Khurana and subject expert for this topic is Dr. Brijesh Kumar Tiwari. Today we are going to deal with an interesting and learning episode of B.Pharma on the important unit of clinical and hospital pharmacy with title Organization and Structure of Hospital. Let's start our episode while taking a look at what we are going to learn today. Number 1. Function of a hospital, classification of hospitals, organization of hospitals. Number 2. Management of a hospital. Number 3. Hospital pharmacy. Number 4. Hospital pharmacist and his abilities. Number 5. Pharmacy and therapeutic committee. And finally, budget preparation and implementation. Hospital is an institution of the public health or a specialized intricate organization which make use of physician, surgeons, pharmacists and team of technical staff. It also provides facilities for diagnosis, treatment, therapy, rehabilitation, prevention, education and research. In another term, the hospital is a complex organization utilizing combination of intricate specialized scientific instrument and functioning through a corps of trained people educated to the problem of modern medical science. Hospital provides various facilities. Nowadays, tools like X-rays, ultrasound, ECG, etc. have become an important part of the hospitals. In the last few years, hospitals have started providing not only therapeutic treatments but also focusing on prevention of disease. Understanding of the hospital and its organization possesses is an essential aspect in hospital and clinical pharmacy. Let's move to module 2, that is function, classification and organization of hospitals. As every organization has functional organizing structure along with some duties and responsibilities, so let's have a brief idea about function of hospital. It is a general overview. It may differ from hospital to hospital, but this is a basic function of any hospital. So, have a close look on it. Number 1. To increase the quality of law and general standard of medical practice. Number 2. Hospital provide the means and methods by which people can work together in groups with the object of care of hospital, department, patient and community. Third, hospital lowers the incidence of disease through early detection and treatment. Number 4. Types of need for facilities, supplies and equipments for evaluation, maintenance and control. Fifth, it is a common link between the community and policy makers. Sixth, to aware the general public by organizing special camp related to human health. Seventh, to participate and establish the safety program of the hospital. Number 8. To estimate the requirement of department and staff recommended and make the policies and producers to maintain competent staff. Number 9. To develop and maintain the system of clinical and administrative services. Number 10. To provide the facilities for education and research projects for the competent staff. Classification of hospitals. As for general information, hospitals may be classified according to basis of clinical and non-clinical facilities on the basis of size, on the basis of cost, budget and system of medicine. So let's start with a little brief of it. On the basis of clinical and non-clinical facilities. Clinical includes medicine, surgery, maternity, whereas non-clinical includes government, non-government. On the basis of size, large hospital number of bed includes 1000 or more than 1000. There are medium hospitals number of beds in which are between 500 to 1000. Small hospital in which the number of beds are between 100 to 500. Very small hospital, number of beds where there is less than 100. Now on the basis of cost, number 1, elite hospital. They are also called 5-star hospital having deluxe room equipped with TV, telephone, refrigerator with higher rates. These institutions having some provision for stay and treatment of poor people. Number 2, budget hospital, which are meant for medium and low budget people. Ex-civil hospital and charitable hospital. Number 4, on the basis of system of medicine, there are allopathic hospitals, Ayurvedic hospitals, homeopathic hospitals, Unani hospitals. Organization of hospital. Organization of a hospital is a dynamic process in which managerial policies bring people together for achieving the common goal and objectives. In this organization, a main governing body or the board of director or board of trustees, which includes some eminent personalities from the system of education, medical research and some other field like politics. All the program, policies and plans for the hospital administration. Governing body appoint various committees and a hospital administration to get the following services, like number 1, the nursing services, which is 24-hour duty by the nursing staff for the care of patient. Number 2, outpatient services. Hospital provide preventive, diagnostic and curative services to the outpatient. Number 3, hospital pharmacy services, which provide all services related to the prescription, compounding, dispensing and administration of drug. It is also responsible for drug delivery information, storage of drugs, sterilization, manufacturing and advice to the physician to the use of drug. Number 4, radiological services like sonography, X-rays, ECG, CT scan, etc. Services are performed by the technician under the direction of a competent radiologist. Next is central supply service, which includes collection, processing, storing and issuing the all medical and surgical supply services for diagnosis, treatment, prevention, research and education. Next one is medical records. These are the important reference material which help medical and paramedical staff for evaluation, education, training and research, which contain patient history, laboratory test reports, physical examination and physician's advice, etc. Next is stores. On the basis of requisition from the various departments and wards, a store receives, store and issue the material like journal items, surgical life-saving drugs and certain articles. This is a procedure by which a managerial department can plan, organize and control any organization. For example, material management, financial management, human resource management, marketing management, and the computer application, etc. Objectives and procedure for material management. To develop a system of supplies, it should be stored in the manner that an item can be easily traceable and distributed easily according to the use. Secondly, to ensure that the resources available are used more efficiently and drugs for stores should be purchased at the most economical price. Procedure. For the achievement of above objective, the categories of stock be determined and estimate the quantity and quality of each item. Then, procurement of item of good quality from various resources at most economical prices. Then, item be received and payment made regularly. Received items are stored properly so as to prevent deterioration during storage. At last, the development of control on inventory and proper distribution system of drugs. Store management. It is a function of receiving, storing, documentation and issuing of materials. In the hospital, it requires huge investment to ensure accuracy, preservation and safety of material at all stages of store management. Objective of inventory control management. The objective is to reduction in the investment in inventories which are not required and minimize the wastage of time by avoiding out of stock. In the hospital, this is one of the most important departments among several departments of a hospital. Hospital pharmacy deals with procurement, storage, compounding, dispensing, manufacturing, testing, packaging and distribution of drugs. It is also concerned with education and research in pharmaceutical services. A hospital pharmacy is controlled by a professionally competent and a qualified pharmacist. Modern hospital pharmacy also provide clinical services for drug monitoring and drug information system. Now comes towards the function of hospital pharmacy. This is an essential service in the hospital which is managed by qualified pharmacists like purchasing, storing, handling, pricing and dispensing, as well as provide all information pertaining of drugs to the health professional and community. Hence, pharmacists act as a link between the medical practitioner and the patient. Following functions are performed by hospital pharmacy. Number 1. Provide special procedure for purchase of drug, chemical, surgical, biological and other articles related to medical health. To manufacture and distribution of medicaments like parenteral, tablets, capsules, ointment, stock mixture and transfusion fluids. Next is sterilization and dispensing of parenteral formulation manufactured in the hospital. Fourth is store management, which includes purchase and storage condition and record maintenance. Fifth one is filling and labeling of all drug containers. Sixth is establishment and maintenance of drug information center. Seventh is counseling of outpatient related to supply of drugs. Eighth is maintaining relation between medical staff, nursing staff and patients. Ninth, assist in teaching and research programs of the hospital. 10th, containers with worn and missing labels and expired drug disbarment. 11th, maintenance of patient chart in the ward and providing drug monitor services. Objectives. Number 1. Hospital pharmacy should ensure the availability of the right medication at the right time in the right dose at the minimum possible cost. Second, professionalization and function of pharmaceutical services in the hospital. Third, to act as counseling department of medical staff, nurse and for patient. Number 4, acting as a data bank on drug utilization. Fifth, establishment of policies for the hospital and plan, organize and implementation of these policy procedure. Sixth, to participate in research projects and coordinate with other departments of the hospital. Hospital pharmacist is a diploma or degree holder, well educated, trained, skilled and competent person which perform all the work related to hospital pharmacy. Hathi Committee has also recommended that for fluid manufacture should be done under the supervision of M.Pharma assisted by B.Pharma and D.Pharma holders. Hospital pharmacist should have the following responsibilities. Number 1. The technical ability. A hospital pharmacist should have a technically sound for all basic knowledge like pharmacology, toxicology, dosing, route of administration, etc. He should provide comparative evaluation of data on drug action, doses, toxicity and cost. Second, administrative ability. A hospital pharmacist should maintain all the administrative work properly like preparation of work schedule for the staff, maintain all the administrative work properly like preparation of the work schedule for his staff, maintenance of legal and administrative record, development of charging policies for the patient, framing of various policies and procedure to get the work done. A chief pharmacist is responsible for interviewing, selecting and evaluating the staff member for the work in pharmacy. Third, ability to develop a manufacturing section. Manufacturing of medicament in hospital require a proper supply of raw materials, proper equipment and proper handling and operation of procedure. Hospital pharmacist should organize manufacturing functions by doing proper cost-benefit analysis. For proper running of the service, a pharmacist must have readily available equipments, trained personnel, etc. Fourth, ability to conduct and participate in teaching and research program. Pharmacist should have information about the journals. He also should have the knowledge of a new method of preservation, preparation and improvement of taste and efficacy of medicament and should create new ideas for all types of procedures. Pharmacists should also provide the training for the nursing and other staff for use, storage, dosage form and calculation for dose of drug. Fifth, ability to control inventory. A pharmacist should maintain all the inventories in a proper stock register and updates it time to time after issuing the drugs to different departments of hospital and also invite tenders from the suppliers with proper communication. PTC is a group of educated and skilled persons which formulate policies regarding the therapeutic use of drug, composed of physician, pharmacist and other health professionals. This committee play dual role like number 1, advisory. PTC assists in the policy formation regarding evaluation, selection and therapeutic use of drug in hospital. Second is educational. PTC assists and recommends various functions to the medical staff, other health professionals for the current knowledge and related to the use of drugs. Their functions are number 1, act as an advisory board to the medical staff. Number 2, to develop a formulary and compile all the information of drug related to the use of drugs. Third, PTC recommends written policies and procedures for selection, procurement, storage, distribution and use of drugs. Fourth, recommendations related to stock of drugs in wards and emergencies. Number 6, PTC plan and provides suitable educational schemes related to the use of drugs. Apart from these functions, PTC can play a very important role in drug safety, adverse drug reaction and emergency drugs. According to the Institute of Cost and Work Accountant, London, budget is a financial or quantitative interpretation prior to a defined period of a time of a policy to be pursued for that period to attain given objectives. Helmer described budget as an instrument through which hospital administration, management at the department levels and the governing board can review the hospital services in relationship to a prepared plan in a comprehensive and integrated from expressed in financial term. Some factors which quoted by Larson for effective budget will be considered by pharmacists like personal consideration, institutional consideration and demographic consideration. It is a responsibility of chief pharmacist or director of pharmaceutical services to take all necessary action and ensure that the functional budget of the department are compatible to each other with following characteristics. Like number 1, budget should be in most profitable direction by use of more economic capital. Second, by proper use of equipment and maintenance of all medicine, a pharmacist can reduce the wastage and loss to minimum. Third, budget can act as a safety signal for the chief pharmacist and indicate as to when manufacturing can be safely undertaken. Fourth, it provides data for filling tenders and preparing questionnaires. Fifth, it acts as friend and guide to the management. Sixth, it helps to overrule the possibility of hasty decision. Preparation of budget. Budget of a hospital is classified into following 3 divisions. Number 1, income account. In order to prepare budget, income is calculated by maintaining annual records. Thus, the average total sum up represents into income of the departments from various sources, generally by the sale of drug to inpatient and outpatient. Second, expenditure account. Fixed expenses generally remain fixed at all levels and categories in following expenses. Number 1, administrative expenses. Number 2, expense for professional care. Number 3, expense for outpatient. Number 4, emergency expenses. Number 5, miscellaneous expenses. Third, Equipment and construction budget. In a hospital, a separate budget is always prepared for equipment and construction due to the requirement of major money funds. Implementation. Budget is an essential tool for achieving the object of a hospital, but there should be time-to-time implementation for long-term planning which facilitate the hospital administrators to take right decision according to the need and requirements. Now here we comes at the end of today's topic, that is organization and structure of hospital. Before I say goodbye for all next session, here we may recap what we have learned today. In today's lecture, we have got a brief idea on functions of a hospital, classification of hospital, organization of hospitals, management of a hospital, hospital pharmacy, hospital pharmacist and his abilities, pharmacy and therapeutic committee, budget preparation and implementation. Hope it was a quite interesting and learning session. I will meet you again with other interesting episodes in coming days. But if you want to know more and learn, you may visit to our website cec.nic.in for more interesting facts, lectures, quizzes, frequently asked questions and many more. Till then, goodbye and keep learning. Thank you.